so what we're looking at here is the vertebral column in its articulated form. So we're looking at it from an anterior perspective here, and we know it's anterior because these are the vertebral bodies, and they always point anteriorly. Separating each adjacent one is an intervertebral disc. This is made of fibrocartilage, which has a lot of water in it, which helps to cushion and shock absorb between adjacent vertebrae. Now these yellow things you see sticking out are your spinal nerves that are forming, getting ready to go into the periphery. This red you see here, this is a blood vessel. This is in particular your vertebral artery that heads up towards your brain. So from here we can see our distinctive types of vertebrae. Now the vertebral artery runs through the transverse processes of the cervical vertebrae, all 7 of them. So we know that this is cervical vertebrae 7, 6, 5, 4, 3, 2, and 1. And this is representing the occipital bone of the skull and how they articulate. Now, if we flip this over and look at it from a posterior view, you can see how the vertebrae change. So the first 7 cervical, they get bigger as they go down, but they all have their transverse foramen with the vertebral artery running through. The spinous processes are pretty short. Some of them are forked. The thoracic vertebrae have these long downward pointed spinous processes. And once we get to the lumbar vertebrae, they become more short and blunt and more moose-like in appearance. Now remember, cervical vertebrae 1 has no body, also called the atlas. C2 is the axis. Everything else is cervical, down to 7. The thoracic vertebrae are interacting with the ribs, so there would be a set of ribs on each side. And the lumbar are just there holding in the weight, and they will articulate with the sacrum, this kind of heart shield-like fused set of vertebrae that connects our os-cox or hip bones together. And you can see yellows representing the spinal cord inside the vertebral canal. Importantly, if I turn this to the side, you can see that where the superior articular process of one vertebrae articulates with the inferior articular process of the vertebrae above it, it creates a little opening, an intervertebral foramen that allows those peripheral nerves to get out of the vertebral canal. And again, on one of the other videos, I gave you this mnemonic, but a way to remember numbers and positions. Breakfast at 7, lunch at 12, dinner at 5.